We've spoken a lot about pigmentation on the face, but not so much on the body. Now, I know that the beautiful Sophie Keisha is coming into Candela Medical head office today for a pigmentation treatment on the body. So I'm going to grab Kirsten again. She is, of course, Candela Medical's clinical educator. I'm going to stick my head into Sophie's treatment with her permission, of course, and I'm going to find out everything that you want to know. When we see pigmentation on our skin, what are we actually seeing?
Pigmentation is an overproduction of melanin on the surface of the skin, and it looks like a little brown spot or a dark patch.
So what are some of the most common causes of pigmentation?
There's lots of common causes of pigmentation, but the main cause is UV damage. Then there's hormonal changes, pregnancy, menopause. There's medications such as the contraceptive pill. These are less common, although they are all concerns.
And how should we go about treating it?
So treating pigmentation, the short answer is, first of all, you need to do a really good skin consultation. You need to find out the how, the why, when and where. Then you'll need to make sure that you put a good treatment plan together, and that will include a really good skincare regime and then a choice of devices that you can use from there. If you're confident that you can use a long pulse thermal device, then IPL is definitely my choice for lighter skins with epidermal pigment. And if you're treating a darker skin, then we do recommend that you choose the safer option, and that would be our peak away device, because we have such short pulse durations. They're pure picosecond pulse durations that treat the pigment with very, very little heat in the dermis.
So talk me through the treatment. What does it entail?
So today I'm going to be using our IPL device, our Nordlys device. My patient today is a Fitzpatrick 2. She's had some sun damage over the years from playing sport, from being such a fair skin and not reapplying sunscreen. So I'm going to be using the PR530, which is a narrow band wavelength from 530 to 750. So therefore, that wave band of light is only going to be absorbed into the pigment and not into the water in the skin. So there's not going to be much heat, but there'll be some darkening of the pigment.
So what I'm going to be treating is the pigmentation on the chest here of my model. And I've just applied a little bit of conductive gel, and what that's going to do is to stop the reflection off the surface of the skin, because light reflects off skin really easily, and we want the light to absorb straight into the pigment. How did that feel?
Yeah, it's alright.
Good. Let me know if it gets too painful. Okay, so we're going to do the next row here, 3, 2, 1. Now it is recommended that you have a skin check before you have any photo rejuvenating treatments, just to make sure that there are no precancerous lesions. And just giving her a little rest, because I've done 2 rows and working up towards the clavicle bone. It does get a little bit more painful because it is closer to the bone and the bone reflects the light. But I can see her little freckles darkening already, so we're going to get some nice results. You've got to remember, IPL is many wavelengths, so it is treating multiple levels in the skin, and it is a long pulse thermal device, so when that light is absorbed into the pigment, it converts straight to heat. You certainly know when you've missed a spot, because you'll see a red area and then a little white patch right in the middle there that I missed, so I just went back and redid that. Now what I'm looking for and expecting to see is some darkening of her freckles across here, and I can see that happening already. So you can see the redness, the erythema, and of course the darkening of these sunspots. Okay, so what I'm doing now is I'm going to treat just a little bit of pigmentation on her shoulders from sun UV damage over the years. And it's great because this is actually darker than what was on her chest, which means that one, I can turn the energy down, and two, we're going to get a really great result. 3, 2, 1, just keep your eyes closed. So now talk me through, how's it feeling pain wise?
You can definitely feel it. It's probably quite warm. I would describe it as quite warm after you zap it, but it definitely cools down within about a minute, I would say.
Great.
This is less painful here on my shoulders.
Oh, that's good. Again, we probably need to check in anywhere between 4 and 6 weeks with soap, and then redo or do a second treatment, and she may need a final third treatment, depending on whether we've got all the pigment, and there may be some lighter pigment left over that just didn't budge on these settings, and I may need to increase the energy in the second and third treatment.
So we're all done. Is there any downtime with this treatment?
Well, there's going to be some darkening, as I said before, of the pigment, which is normal. And there will be a little bit of erythema as well. So she might feel a little bit of heat after the treatment. That should pass away within 2 to 3 hours. And we will apply some cold packs if necessary, some post-laser gel and SPF before she leaves. And then again, we recommend that she just stays nice and cool.
And how many treatments would we be looking at to really see results?
Again, I think that they'll probably need up to 3 treatments, and we need to do those treatments 4 weeks apart on the face, and then of course on the body with slower healing, somewhere between 6 and 8 weeks apart.
So what does a good aftercare routine really look like?
With a pigment treatment, we definitely need to make sure that your patient is using really good skincare, and that's going to include some ingredients that reduce the overproduction of melanin, and some hydrating ingredients, and definitely an SPF between 30 and 50, and avoiding direct sun exposure on that area. And then perhaps a maintenance treatment every 3 to 4 months. And then they could probably think about other treatments, rejuvenating treatments that refine the texture of the skin as well.